Hello, dear friends. I am Dr.Jothydev Kesavadev. I am a medical doctor and a researcher. I am not an engineer. This video is on Apple Watch and Apple Health. And I promise you, this is going to provide you with incredible possibilities, unlimited possibilities for maintaining your health. And it's going to be useful for doctors, public, and for the patients. So please watch this video. So I'm going to share my screen. Apple describes Apple Watch as the future of health on your wrist. I am going to modify this, the doctor on your wrist, and I'm going to explore the possibilities of Apple Watch in diabetes care and beyond diabetes. I don't have anything to disclose. Apple hasn't paid me anything for this presentation. Historically, it was in the year 2007, the Apple phone was launched. And in a couple of years from then, in the month of April in 2015, Apple Watch was officially launched. Both of these were really disruptive technologies, replacing many of the popular existing devices and instruments, such as a calculator, the ordinary mobile phone, the torch, the transistor radio, the computers, and so on. And the story continues. Nowadays, when patients are approaching doctors, many of them are just showing their Apple phone. See, doctor, these are my number of steps over the last month, over the last 1 year. But let me tell you, now it is beyond the number of steps. It is well beyond the number of steps. Apple Health can be described as one centralized hub for the entire health-related data and information, which is collected from the apps, which is collected from the third-party apps, and from the multiple sensors, which include the sleep trackers, the step trackers, the mental health apps, the reproductive health trackers, and many more. And if you ask me, is my data secure, doctor? The answer is the health data in Apple stays with the device and is entirely secure, safe, and is encrypted. And Apple knows what you require the most. And with the help of artificial intelligence and deep machine learning, it identifies those data which is of most interest to you, such as the number of steps or the physical activity or the sleep-related information. And these data will be highlighted on a day-to-day basis. Very interesting. These are the sensors in the Apple. And these sensors are much more advanced with each generation of the device. In the most recent Apple Watch Series 7, you have the accelerometer, you have the gyroscope, you have the heart rate sensor, you have the barometer, you have the altimeter, you have the SpO2 sensor, you have even the VO2 max sensor. Incredible, incredible. Let me now move on to the most exciting feature for me. And this is the single lead electrocardiogram. Apple has again pioneered in bringing ECG in Apple Watch, in a smartwatch. But Apple always caution you, and this is a statement, never use the Apple Watch ECG for diagnosis of a heart attack. It is not meant for diagnosis of coronary artery disease. It is just meant for identifying or distinguishing between a normal and an irregular heartbeat. Still, I am going to share with you a real life experience. Let me have a demonstration for the non-Apple users, and this is how the ECG can be recorded in the Apple Watch. So you click on the ECG app and then you place your index finger on the crown of your watch. It hardly takes half a minute for measuring a single lead ECG. This instance happened to me during the peak of the COVID lockdown last year. This was the first consultation of a new patient via a video telemedicine consult. A 51-year-old gentleman with diagnosis of diabetes 10 years ago. He was on irregular medications, especially on irregular dosages of statins. Presenting complaint, discomfort, chest discomfort during the time he climbs stairs. And this is there for the past 3 days. I soon realized that this guy is using an Apple Watch and an Apple phone. I requested him to send an ECG via an email. He did it. The ECG was perfectly normal. Then I requested him to climb the stairs, and when he is experiencing the discomfort, repeat the electrocardiogram. He did it. He did it. And this is the second ECG at the top. And there is significant STT changes. I immediately referred the patient to a nearby higher center where he underwent intervention. Yes, during the lockdown, Apple Watch has saved the life of a 51-year-old gentleman. These are the categories under the health, the broad 4 categories: activity, mindfulness, sleep, and nutrition. Let me begin with what Apple has been doing proactive during COVID-19. As you know, in COVID-19, majority of deaths have happened in diabetes. And it is very important that you need to have a normal glucose throughout. And even after diagnosis of COVID-19, you have to make sure that you should be maintaining glucose at normal levels. And that depends upon the device you are using, and better to have a time in range, more than 95% of the time. So let me start with heart rate variability. There are a lot of studies related to heart rate variability from Apple Watch and COVID-19. What is heart rate variability? Heart rate variability stands for how much the time between the 2 heartbeats varies from one beat to another. Apple Watch can automatically track the information on HRV when it is tracking the heart rate. This is a study related to diagnosis of COVID-19, use of physiological data from a wearable device. And this is from the Mount Sinai Health System in the United States. And the participants were those working in the same center, equal to or above the age of 18 years, willing to participate, and all of them having an Apple Watch Series 4 or higher. Let me now have a demonstration on the heart rate sensors. Apple Watch is equipped with an enhanced photoplethysmogram optical heart sensor, and this combines, there are 2 components. As you can see over the video, there is a green light emitting diode, and this is paired with a light sensitive photodiode, generating time series peaks. And this correlates with the magnitude of change in the green light. The magnitude of change in the green light, it is generated from each heartbeat. The time difference between the heartbeats is described as the interbeat interval, or IBI, from which you can calculate the heart rate variability. So what are the findings from this study? Significant changes in the circadian pattern of HRV, specifically the amplitude of standard deviation of the interbeat interval of normal sinus beats. And this was associated with a positive correlation with the diagnosis of COVID-19. And this has been found applicable even in those subjects without any symptoms of COVID-19. So even in the absence of symptoms, Apple Watch and HRV related metrics were useful in making a diagnosis of COVID-19. Moving on to SpO2, another path-breaking step with Apple. So the Apple scientists have been innovative and successful in bringing an app and a sensor for SpO2. And Apple has again been a pioneer. So this is demonstration. It takes hardly 15 seconds to measure the blood oxygen levels. So if you have symptoms, you can keep on measuring probably multiple times daily. But even in the absence of symptoms, Apple automatically monitor the blood oxygen levels throughout the day and even during the night, multiple times when you are sleeping. Hand washing, yes, Apple scientists were not sleeping during the pandemic. Let me have a demonstration of hand washing. The moment you start washing your hands, the Apple Watch detects and helps keep going for the amount of time, that is 20 seconds, which is recommended by the global scientific organizations such as the World Health Organization. So good job, you have completed 20 seconds of washing your hands. Respiratory rate, another very important vital parameter. Apple Watch is capable of measuring, monitoring, and recording your respiratory rate during the day and even when you are sleeping. So we have the resting or the sleeping respiratory rate as well. This has been a basic functionality right from the beginning. From 2015 onwards, the heart rate sensors, Apple Watch keep on tracking your heart rate and will notify you when the heart rate is above a particular number or below a particular number. So this is a high heart rate notification. Your heart rate rose above 120 beats per minute, while you seem to be inactive for 10 minutes from 8:33 p.m. onwards. Very, very vital information. Now moving on to the activity apps in Apple Watch. I will say that this has been a stupendous success with Apple in engaging the users. Engagement has been possible and has been successful with gamification. Because you'll be downloading your activity apps or the health apps and you'll be no longer using it. That is not the case with Apple. Apple pushes the user to complete the 3 activity rings throughout the day. The exercise, the movement, the standing goals. It gamifies the fitness goals, constantly nudging the user to finish the rings throughout the day before you go to sleep. And you have the rewards, you have multiple challenges, you have awards and so on. For example, the Earth Day challenge, the Heart Month challenge. First cycling workout, there is a reward. So it keeps on going. It's endless. It is limitless possibilities. Let me now again have a demonstration on, and this is on the workout possibilities. Here again, you have hundreds of workout options. Outdoor run, functional training, outdoor walk, indoor run. So again, the possibilities are multiple. So you can have the daily information, the weekly information, or a 6 monthly information, or yearly data which is rounded up below the daily details. And this includes in-depth information, further in-depth information, if you would like to, on exercise, total minutes, the resting energy, and so on. During the pandemic, many of us were sitting for long hours, and sitting is a new smoking. Sitting for a longer period of time, it increases the chances of diabetes, heart disease, and other lifestyle illnesses and complications. The watch is equipped with a great feature that helps the wearer tackle the sedentary lifestyles. It won't permit you to sit for more than 1 hour. It encourages the user, and this is with a trigger, time distant, triggers a haptic on the wrist, and it can even play a notification specific audio tone. So it encourages the user to stand up, walk around for at least 1 minute. Cardio fitness, I would say, is similar to a treadmill test. And this appears on your watch, on your phone, only when you are having a workout outdoors. When your GPS is on, with the help of your respiratory rate and on your VO2 max. There are 3 categories: low cardio fitness, medium, and high. And in the instance of a low cardio fitness, look at the notification over there. This may be due to an overall lack of physical activity or a medical condition that's impacting your cardio fitness. And this is a time you should be urgently meeting your cardiologist or your family physician. And this is a great feature, very, very exciting feature with Apple Watch. And this is on body composition. And the app allows us to enter information about the body fat percentage, the body mass index, the lean body mass, the waist circumference, and so on. But this has to be manually logged in. And this is again the nutrition tile in health. And this is to track the food intake. But here again, the method requires the user to input the data. And for women, there is another exciting new feature, and this is a cycle tracking feature. To track your menstrual cycle, it can log all sorts of information, including the symptoms such as the cramps, the headaches, the mood changes, the basal body temperature, and so on. It can even predict the next menstruation and even the ovulation cycle. Mindfulness, often ignored, but very important. And I promise you, this will enhance even your cardio fitness. You require not only exercise of your body, you also require exercise of your mind. This is akin to meditation. Encourages to set aside a few minutes every day. This can again be programmed in your phone to focus, to center, and to connect. Sleep, another very vital information. Not only the duration of the sleep is important, for metabolic illnesses, for lifestyle illnesses, for prevention of complications, you require adequate sleep. You require adequate time spent in deep sleep. You can either use the Apple Health app or you can depend on other third-party applications. So this is one example on how the Apple is providing you with the information on the total duration of the sleep, the time which is spent in deep sleep, in restful sleep, in light sleep, and the time you were awake or disrupted when you were sleeping. Very interesting. And the sleep efficiency, the number of stars, and the heart report based on your sleep efficiency. Apple Watch is capable of sensing the noise levels. The hearing can get impaired, not only in diabetes, hearing can get impaired when we are growing old. Apple has got multiple sensors, not only to sense the environmental sound levels, but also to sense the headphone audio levels. Let me have a demonstration. And this is a demonstration where I am going to produce a noise loud enough so that it is above 80 decibels, and hence the color is changing from green to yellow, denoting that it is a louder noise. Hello, 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 hello. I will repeat. Hello, 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 hello. Yes, why is it important? Even brief exposure to a very loud noise, such as a concert, it can result in temporary hearing loss. And repeated exposure to loud sounds on a long term can damage the hairs inside your inner ear, and this can result in permanent hearing loss. And hence, this is yet another a great feature. While going through the hearing information, I found that there is a noise notification on the 3rd of November. And while reviewing, I found that this was on the Deepavali evening when we were bursting the crackers. Very, very interesting. And this was around 9:48 in the evening. Moving on to the mobility app. Mobility app has undergone several transformations, and now the sensors can capture data that reveals the mobility metrics. And these are some of the new metrics: the double support time, the step length, the walking speed, the stair speed when you're climbing upstairs, when you're climbing downstairs, the walking asymmetry, the walking steadiness. So why is it important? Walking steadiness is a metric that can measure your balance, that can measure strength, and that can also assess the gait, how you walk. And now we can get notifications from the Apple device if the walking steadiness is low or very low, or when we are at an increased risk of falling. There will be a notification that you are going to fall. And if there is a fall, and this is the one, it looks like you have taken a hard fall, it can immediately call upon the emergency numbers. Yes, this is another, I will say, this is the most important, most interesting and unique feature of the Apple Health. It can automatically notify your close friends or a caregiver or a relative or your doctor. So this is decided by you. You can decide which are the data to be shared. For example, you can share the data on heart rate alerts, high or a low heart rate or an irregular rhythm or a fall, and you can opt that you won't be sharing the information on your physical activity. And you are the person, you will be the person to decide whom the data should be shared with. The medical preparedness. With Apple, you have the medical ID. You have to make sure that the entire demographic information, the full name of the individual, the age, sex, height, weight, the blood pressure, the blood group, the medical conditions, the details of all the illnesses and the medications, including the allergies, need to be there stored in the mobile phone. And always remember that you have to enter the emergency contacts and the phone numbers in the medical ID. Why? The reason is the medical ID on the Apple Health is the digital version of your emergency medical card. So now if you're asking me if I have a dream or not, these are my dreams. Currently, Apple doesn't have a sensor either for glucose or for temperature or for the blood pressure. It can display the information on glucose from the connected glucose meters or from the connected CGM devices. And my dream is to have inbuilt sensors for glucose, temperature, and blood pressure. I would say, I would rather further modify this statement made by me in the beginning. It is not just a doctor on your wrist. It is the hospital on your wrist. Apple devices, Apple Watch, it's saving thousands of lives daily around the globe. And if you are asking me a question, isn't it very expensive? My answer is, the device is worth the cost of life. Dear friends, thank you very much for being with me and watching this video. And I believe this has been very informative. Thank you very much.